my culture at least, we don't advertise going to therapy. It's not something that we talk about. We more so handle it within our household. So my main goal of being in this field is to bridge that gap between people of color and actual formal therapy, and trying to provide a voice and break down the stigmas against actually getting formal treatment. I came to UNC because, first of all, it's a really, really great program, and it's a great school, so it's hard to turn down this program. But also, they do a great job of balancing the vocational rehab with the clinical mental health side. So a lot of programs that I did look into, it was either one or the other, or if you wanted to do both, you had to stay longer, you had to pay extra, which was a finance that I could not, do at the time. But our program does a really well job of balancing the two, and that puts us like a leg up in the competition when we do apply for jobs. But also, you're not gonna come across a person who just needs mental health services but doesn't need vocational help, or who just needs vocational help but doesn't need mental health services. They're more so in conjunction. I would say don't let the clinical rehabilitation deter you from applying. So a lot of questions come in around the vocational rehab side, because that's not something that a lot of people want to do, but it is an essential skill to have as a counselor. So even if it's not your main focus coming in, that's perfectly fine. Even if it's not your main focus coming out of the program, that's still perfectly fine, but it is a skill that you want to have in your back pocket. So I wouldn't let that one piece of our entire program deter people from actually applying.